Welcome to the King's podcast, The Wellness Dive. I'm your host, 𝘓𝘓𝘓𝘓. And today we are joined by Dr. Sana Kausar. Welcome, Dr. Sana.
Thank you very much, Esther.
Can you just start by introducing yourself, what it is that you do?
I'm Dr. Sana Kausar and I'm one of the family medicine consultants at King's College Hospital. So basically I work with adults, children, young people, pretty much anyone, and that means that I'm exposed to quite a lot of different types of problems.
Today's topic is all about mood disorders, burnout, and how to cope. Okay. Let's start with burnouts. How can one recognize that they are on their road to a burnout?
Well, this is the thing. In Dubai, so many people are working such hard jobs and long hours that it becomes partly an expectation that people do 50, 80 plus hours a week at some level, maybe when you're young or when you're in training posts and when you've got the energy and the capacity. But if that continues onwards for many, many months and years, then what happens is your body and your mind obviously can't cope with this situation because it stops being a balanced situation. And that's when we start to see signs of burnout.
Okay, and what do these signs include?
It can be very variable, but it's one of the strange things that I've noticed recently in a lot of people in Dubai is that sometimes people stop being able to sleep. So even though they've been working 16 plus hours, they haven't had a day off, when they go to bed, their brains are still whirring so fast and their thinking won't stop and they start having ruminating thoughts, etc., etc. And they eventually get to a point where they almost crash. So they get to a point where, and that's the classic traditional feel about burnout, is that they stop being able to cope. And again, in young, healthy, physically healthy people, they quite often don't expect this of themselves. So then they become quite high functioning people that are on the road to burnout. So they're continuing. They don't want to look like they're not able to do their job. They might have high powered positions. They might be in charge of hundreds of people or regions that have got different time zones. And all of it adds into this perfect disaster whereby they just sometimes, even can become suicidal because they can't cope with things anymore. And that's one of the things that I try and warn the younger ones about that come in and tell me. Many consultants and lawyers, etc., come in and they tell me how many hours they're doing. And I start off by saying to them that, look, you're doing it now and you seem fine now, but in the future, as time goes on, this is definitely not a sustainable way to live. And you need to start by just recognizing what a healthy pattern of life is.
So you're telling us this because you've seen patients who've exhibited this kind of symptoms?
Yeah, almost on a daily basis.
Let's say in 1 week, how many patients do you see who are suffering from burnout?
Many patients, and some of them, they might not necessarily come in with exact, they don't come in and tell you they have burnout, but a lot of the stress-related symptoms come out in the physical body. So some of them might have IBS worsening, some of them skin diseases might be out of control, some of them again come in complaining that they can't sleep. Some of them are having panic attacks and palpitations coming out of nowhere. So all of these things, they can sort of be added into a sort of stress-related sphere of, and when you question people and ask them, what does your day look like? What does your week look like? That's when you can figure out that actually this is a bit of a massive imbalance in life. Mm-hmm. And there's really no downtime. There's not enough sleep going on. There's not enough relaxation. There's not enough connection with friends and family. It's like sometimes there'll be women and they'll be towards their late 30s. And on paper, they've got a fabulous job, but have they had time to make a relationship? Have they got time to think about what they maybe want in the future? And how does that look? What would it take for them to be able to put in place what they need for a future that they actually want, Mm-hmm. So one of the things I've been saying to people a lot is, you're on a treadmill, you're running really fast, but if you were to drop dead, you would be replaced very fast. So you need to put yourself first and have a think about what you want out of life and how to go about getting that.
Wow. So you actually mentioned that you see quite a large number of people suffering from burnout every week. Mm-hmm. Is it possible to sort of let us know from which type of industries these people work in? Because you mentioned 60-hour weeks, 80-hour weeks. I mean, what particular industries are these?
Dubai being Dubai, people work long hours. Sometimes they're lawyers, young lawyers, etc. Sometimes people are working in management consultancy or the finance sector. But sometimes it's other things such as marketing and social media. And sometimes people are covering different regions. So not only are they doing their job, but they're having to be available for people that are waking up at a different time zone, like the Americas. So it's not even in one particular sector. It seems to be this culture in Dubai of working a lot and also not having the tools to be able to push back to your employers or to be doing 2 or 3 jobs in place of one and being afraid to sort of challenge the status quo in case what happens that they're going to get fired or going to get demoted. And another thing I've said to people is, look, we no longer live in a time whereby you're not going to get fed and you won't have a roof over your head. So our challenges aren't that we're fighting to survive anymore. Our challenges tend to seem more like being able to delegate, being able to stand up for yourself, and being able to decide what you need for your life and walk away from jobs, no matter how well-paying they might be, that aren't in your interest and that they aren't going to serve you in the long run, because your life's too short just to be serving a big corporate machine that will literally replace you at a moment's notice.
True, it's true. You talked about the symptoms, yeah?
Yeah.
So let me take you back there. So if most of the people, I don't think everyone suffering from burnout actually comes to you or goes to see a doctor or a therapist. What would happen to these people if they don't seek help? Or maybe they cannot even recognize they're on their road to burnout or they're already burning out.
I mean, I think the thing is, right, burnout as a specific diagnosis is not something that we will put down quite often. And quite often it's just stress-related symptoms. And even if people are continuing on and on, it won't be something they don't know. When you're overstressed as a human being, you know. Like even young mothers, for instance, if they're up every single night and then trying to hold on a job, they know why they're crabby and they've not got enough capacity to, be their best self. They might not always seek help. Sometimes with females, they might talk to their friends, their family, their mum. And with men, that's usually a bit more limited. They don't always open up, so they get emotionally pent up and also trying to hold on to the image of being strong and masculine and not needing help. So quite often it's not that they come in with symptoms. I'm sure there's a lot of people like that are sitting around at home or in their jobs and struggling. It's important that we start talking about these things so that people can understand that actually it's a very common thing. Things are not always what they seem. The Instagram life that people quite often show, or the sort of outward image that you see, isn't always what's going on in the inside.
So it's all fake.
Generally,
most of everything on social media is very far from the reality.
Exactly.
We know that.
And as human beings, we want to show our best side. We don't want to show our vulnerabilities, and we don't want to admit to our vulnerabilities. But sometimes those things held in, if you can't get them out and process them, they will take a toll on your health. And sometimes, the classic being, let's say, a 50-something-year-old executive who's not had time to exercise, not had time to take time out, and suddenly has a heart attack. So that's an extreme case, but it's not an unusual image to have in your mind, Cardiopaths, like high risks of heart disease, etc. It's not going to be helped by a high-stress lifestyle. And if you don't have time to take out, for yourself, then how are you supposed to be in balance with yourself?
So instead of seeking help or talking to somebody who knows them or cares about them, there are people who decide to do some things to cope. For instance, like drugs, alcohol, and whatnot.
Yeah.
Have you met this kind of patients, and how has it gone from there?
Yeah, I think obviously all humans have got a need to find a release in some way. And one of the most dangerous ones in Dubai most probably is alcohol. And again, you'll see a lot of very high-functioning alcoholics, which maybe aren't on paper strictly alcoholic, but that's one of the ways that they cope. And before you know it, especially over COVID, when people were isolated and indoors, the 1 wine a day became 2, became 3, and it became a very common thing for a lot of people. If you're very stressed, then we're only human, so you can see why people will do that. And sometimes, until you question people, they won't always come clean with how much alcohol use there is. Luckily in Dubai there's not so much drug use, but the alcohol probably is one of the worst drugs because it's so socially acceptable and it's so easy to access. But it becomes it's a CNS depressant, so even if it's taking you over on the day, you'll have a downer the next day, and you might feel paranoid and might feel anxious and palpitations, and then the cycle continues. You're taking it to avoid these feelings. The feelings are coming back at you. Some people are now trying to look at conscious sobriety, because a lot of people won't exactly think of themselves as alcoholics, and they might not be drinking on paper the amount to be an alcoholic, but the fact that they're using it so regularly and they can't remember what sobriety feels like over an extended period of time. There's a lot of more research going on about that, about how you will feel if you, for instance, do something. Another one I've noticed a lot is some people exercise a lot, and they'll take on excessive amounts of exercise, and obviously exercise releases endorphins, and I'm loath to tell someone. It is.
When you talk about that, I think about myself. I know I exercise a lot.
Like I've said to so many people so many times that we're not athletes. And we don't need to be, we don't need to be training as if we're athletes.
Yeah.
But if it makes them feel good, then it is one healthy way to, to get some of your energy out and to sort of feel better, and it does release endorphins.
So basically what you're trying to say is that not all exercise is good exercise.
No, the thing is, anything in excess, you have to always wonder what's going on. How, it might be eating. Some people comfort eat. And if it's detrimental if your BMI goes up, you're okay if your metabolism's great and it's not going to affect you. But if your BMI starts to go up, or the opposite, not eating, some people feel like more in control when they become a little bit anorexic, more so in the young people, So anything in excess. And I think one of the things we have to try and recognize is how important balance is. And it's not just like the health balance of sleeping and eating well, etc. It's the connection balance, the being able to connect to people, being able to talk to people. You don't need to have 100 friends, but it's very important to have a few people that you can talk to so that you feel heard, you feel like you belong somewhere and somebody's looking out for you.
But then there's some people who feel like if they're going to talk to their friends or those closest to them or family members, they will be judged or they won't be taken seriously.
Yeah, exactly. And this is the thing, you want to be able to have relationships where you can be accepted.
So Dr. Sana, you mentioned that anybody experiencing this burnout, mood disorders and all, they can talk to their friends or their family, anybody closest to them. But then again, some might not want to do that because they would feel like they're going to be judged by those closest to them. What would you advise for that?
I mean, that's a very natural feeling. Sometimes people aren't so good at opening up, and there's different personality types that some people prefer to talk and some people prefer not to talk. And usually, one of the things is to be aware of your colleagues and the people around you, just to see how their mood's been and see if you can be the kind of person that they can talk to. Otherwise, one of the things people hopefully know is that you can go and talk to your doctor at any point and share it with a professional. There's so many services these days that are available for these things, psychologists, etc. But if you're not sure where you're supposed to go with these things, you can always initially go to your family doctor and we can check other things out, make sure your thyroid's functioning, because sometimes if it's a physical problem, you can get symptoms that might seem similar. And, sometimes you can just talk things through with someone just to see what they think. Like, do I think that you're actually making a fuss out of nothing, which is hardly ever the case? Or do I think that you're actually carrying a lot on your plate and that you're doing a great job, but you don't need to be doing it at this level and, just so that you don't harm yourself emotionally and mentally? So, I'll talk to people often and so, I'll be amazed at how much they're carrying with them and how much they're going through and how functioning they are, how much they're doing it. And then usually the tears come because once you start to release, you start to realize that, somebody can see what I'm going through. And usually what happens is I'll try and talk to them about things that we can do to help, and that there's always something we can do to help. There's the small things that they can do for themselves. There's things that you can do to empower yourself, to push back on excess work, if that's what it is, or bullying workplace. There's always something to be done. And also to point them in the way of mindfulness, because a lot of anxiety comes from being worried about tomorrow.
So that would be the coping mechanisms, yeah?
Yeah, so that's some of the coping mechanisms we try and teach people. We'll try to get them to do breathing exercises because, there's so many different types of breathing exercises and you'll see them everywhere these days. But the importance of them is such that they can actually bring your serum cortisol level, which is your stress hormone, they can bring that down by up to 40%. So if you can learn to slow down your breathing and there's so many guided breathing exercises to do, then that's actually like taking a mini Valium. And if you can preempt your stressful times, you can do it multiple times a day if need be, or take time out, like prayers are over a regular period of time. So when people do that, they actually are taking themselves away from a situation and resetting themselves. So sometimes we teach them strategies like breathing exercises, mini micro meditations, and then, other guided meditations for when you're not on a stressed out situation. So there's a lot we can sort of bring in so that you can at least start to, take control of the situation and not feel like, it's a runaway trolley and you're heading into, something dangerous. And if it gets to the point that I'm more worried than that about someone, and I think that, actually you're not coping and this is not a good place for you to make decisions from, and maybe that I'm even worried that they've got some suicidal thoughts going on or they might harm themselves, then sometimes I'll suggest that we try some antidepressants for them. And again, Dubai being Dubai, it's such a common thing that I do on an almost daily, weekly basis. We start a lot of people on them, and mostly I'll tell people that, look, these things are tools and they're made for us. So we don't need to overthink what it means and stigmatize ourselves. What we need to do is be functioning, coping human beings. And if this helps, it doesn't mean it's going to last forever. It doesn't mean you'll need these crutches forever, but they're tools there to help us. So let's first get in control of how you're feeling and use these things. And then from a better place, from a better mental standpoint, you can decide what you want to do next. So I find that quite helpful. And also that means that I'm calling them back in because they might need more, or they might have side effects. And just having a little bit more regular contact feels like, you can be on top of a situation with people and start to help them through, and maybe not let them feel so alone in a given situation.
In addition to your busy clinic, you're also in contact throughout with your patients, especially the ones with...
I tell them it's quite easy to make an appointment with me despite the fact that I'm busy, because the ones who I see regularly can quite often, make an appointment on the day or the next day. It's not like the UK where you have to wait 6 weeks. So we're also very lucky with the healthcare systems here. And my team, my nurses tend to know who I'm more concerned about, because I'll let them know which ones, if they call or if they want to get seen sooner, they can pop in. And I think all doctors are like this. There are people that we worry about a little bit more. And if that's the case...
So you just keep in touch with them throughout?
Yeah, we can keep in contact with them. And they know that they can contact me through email if they need anything, or they can just pop in if there's a crisis point, which does happen. It's just natural. We're all human. But luckily here we find a way to manage the patients that we do have. It's just the ones we don't know about that obviously... we can't help. But once they've seen someone, they tend to be on a road of, fixing things and it being more in control and being proactive. And so I feel like we all need to learn a lot of self-care, self-compassion, and all of those soft things that might not be very manly, but we all need to, find a way through life. And it is manly to look for help. A lot of my patients are men. They might be middle-aged, and sometimes somebody's told them, go and see Dr. Sana, and they've come in, and by the time they've left, I feel like, we've even in one session of talking to someone properly, got a way ahead. We've planned something together that we're going to, and we've got something to aim for. And the end result might well be, this career is not for you, that's fine. It's okay not to be stuck to a career for infinity if it's going to kill you. That's fine.
True. So there's this thing that it's very difficult for a man to see a doctor for any sort of condition, developmental health. So this burnout being a form of mental health, compared to women, what's the ratio between men and women that you see on a weekly basis?
To be honest, I would say that I see both equally, maybe for different reasons, but there are so many.
Impressive.
Yeah, I think it's pretty much equal because, again, with women and men, a lot of them are doing the same jobs. I see just as many female consultants as male consultants, or female lawyers versus male lawyers. And these executive level jobs are no longer the domain of just men. And so the women that are in these positions quite often have worked a lot harder to get their bearings, to be in any positions. And they're also pushing themselves at a level that was not seen in our mother and grandmother's generations, not so much in my culture anyway, So a lot of the women and men are both, we're all human, so we're all subject to the effect of stresses on us. And whereas women also quite often might have kids at home that they're also watching, they might have households that they're also running at the same time, and then they're expected to do more for the same kind of recognition, which is starting to change. But I think when it comes to like the stress and panic symptoms and low mood and depressive disorders, and the sort of road to burnout, whatever that actually is, then I think I see it just as much in women as in men these days. I think I would say it's probably about equal.
How can one differentiate between burnout and stress? They kind of sound similar, don't you think?
Yeah, I think they are the same in that, burnout is probably further along the line, along the road of stress. And stress is just an umbrella that we can put a lot of things under. You can be stressed from normal things, death of a parent, not being able to go home over COVID. So anything can cause stress. Obviously, anything can cause burnout. You can be a young mum who's not slept with twin babies and you've not slept, so anything can lead to either of them. And it doesn't really help us to particularly differentiate. I think that's more for HRs of a company that might want to label something, and therefore, especially if somebody needs to be out of work for a prolonged period of time. So it might be helpful from that perspective for us to assess people and use that kind of language. But on the whole, it doesn't really change anything, and it doesn't really make a big difference medically. We'll still just look at that person and decide how much intervention they need. How much do they need intervention via sick leave? Do they need more? Do they need more psychiatric input than what I'm able to provide? Do I think that their thought processes are away from normal and now going into psychosis, which is when the lines between reality blur? They might start feeling more paranoid. They might start thinking that everybody's after them. So, your mental health's a fragile thing, and if you don't protect it, then you won't know where you are, right? And then again, like, you could be overusing the alcohol type things, or overusing any kind of drug that people use for addictive purposes to get away from their thoughts. So yeah, there's so much morbidity when it comes to mental health, partly just because of, like I keep saying, the lack of balance in life. I think we all need to take a time out and have some space to breathe and just to be, not to be doing things, just to be being human, being bored, just doing nothing at all.
Speaking of time out, I'm sure you've recommended a few days off to some of your patients that you've seen. And they took the time off. And has it ever happened that their employer called you to ask if it's really true that you've given this person time off?
Yeah, that has happened to me many times, because some employers are quite bullying, and that's one of the things people are afraid of when they're taking time out. They don't want to take time out, So that does happen, and I have had employers calling me, or HR departments calling me, trying to ask more. But then I have said to them on occasion that this is between a doctor and patient. They're entitled to their confidentiality, and they're entitled to be unwell for whatever reason. And I'll quite often keep it quite general, the reason I'm giving for a sick leave. It doesn't need to be, telling them everything that's going on with that person. Sometimes with women, it might be a miscarriage that they're just not coping with. It's an enormous stress to go through that, and it's an enormous trauma. But it might be minimized by people that, what do you mean? You should be back by now. For something like that, I would stick to something simple like abdominal pain. And for stress, I might stick to something simple like headache, palpitations, etc. Really, everybody has a right to privacy. And my patients, and I tell them this, you can say whatever you want between us, as long as nobody else is getting hurt. You're entitled to your privacy, and you're entitled to be unwell enough not to go to work. I think often employers quite often respect that somebody's coming with sick leave, and they don't want to maybe lose that employee. And if they're good employers, they will help you. They will help you, and that has happened. We have some massive companies here, and they send the people that work there to me, and sometimes they just want an assessment, and that assessment might be me saying, look, they need to not work late hours, or they might need to be off or go back to work in a slow way, and they'll respect that, but they just need somebody,
to confirm.
Yeah, to confirm.
Okay, interesting.
So a good employer is very important for your mental health.
It is.
Good leaders are not the ones that are, just the most, cocky and, rich. They're the most kind. The best people you can work for will have to be a team that listens, that cares, and that are kind towards you, and that, that value your input into their company to the point that they don't want you to not be active in the workplace, or not be happy in the workplace.
Yeah, I think quite a number of times you've been going to these organizations to give wellness talks, mental health talks.
Yeah.
How do they contact you to do that?
Yeah, they have their marketing teams, and they have their wellness weeks, and they have quite a lot of them have big sort of things around their health and wellness, and there are some amazing companies out there.
Our people practices department actually focuses on employee mental health and wellness.
Exactly.
They take it very, very seriously.
Yeah, and that's nice. It's nice to be in a place where there will be stuff going on.
It just feels safe.
And the thing is, in places where people are working a lot of hours, sometimes that's a way to make them even more like stuck to that place. So yeah, there's a fine line. But I think in the end, good leaders are the ones who actually care about the well-being, and they're not doing it just to tick a box or just to make it look like they're providing a service.
Exactly.
They're actually doing it because they care. And that one will come down to the employees. The happy employee is an engaged employee. So they want to give more, or they want to be doing the extra things because they enjoy.
They will go the extra mile.
Exactly.
They enjoy what they're doing, and they love where they're at that moment.
Exactly. So even from a company's perspective, to have engaged employees, you have to treat them well.
Dr. Sana, it was a pleasure having you here today.
Thank you very much.
And we look forward to you coming back again.
Thank you very much for having me, Lucky. It's always lovely to chat to you.
Dr. Sana has to go. Very busy clinic. If you liked what you saw and heard, kindly follow us on Facebook, Instagram, Spotify, and YouTube. I'm your host, Esther Lucky. Tell us what you'd like to hear from us next. Until next time, goodbye.